Thank you very much. I appreciate it. Tim Lee, I'm the Executive Director of the Texas Retired Teachers Association, and Chairman Schwartner, I do appreciate the opportunity to speak today. Chairman Nelson for calling this special hearing, and absolutely for Chair Huffman working for a long time to come up with some options for a very difficult problem. So, with that being said, I think my slides are actually being distributed now, but the first two slides just talk about us as an organization. I think most of y'all probably know who we are. If you skip to slide 3, this is a slide talking about a survey where we asked our members how would they like to engage in reforms for TRS-Care. About 7,900 respondents as of last Friday. I think we put the survey out on Friday, and we had 7,900 respondents as of yesterday. Important numbers, I think, for us point out 97% believe that changes to TRS-Care will impact their retirement security. They are willing to pay higher premiums. They are willing to pay higher deductibles and co-pays. Their willingness is there, but they're also asking that there is a shared pain approach. This is typically how we have worked on solutions like this with the pension fund in the past, and that's just something that they've gotten used to. So let's go to slide 4. These are just big picture facts about this population. There are about 100,000 TRS retirees that earn $1,000 per month or less. That's a third of the entire population in TRS. They earn $1,000 a month or less. The average annuity, as you know, is about $2,000 a month. 20% of TRS retirees are eligible for free health insurance as retirees under ERS or UT or A&M. So not all folks that are covered under TRS are in option into TRS-Care, but they do have the free insurance from ERS and some of the other systems. The other 80% are in TRS-Care. As you all know, 95% of our school districts do not participate in Social Security. They are affected by provisions like the windfall and the GPO, and I'm happy to answer any questions about those if you have them. Slide 5, on the Medicare population, TRS retirees on average are 71 years old. About 27% of TRS-Care participants are less than 65 years old and don't qualify for Medicare. This became very important information when TRS first laid out their LIR, and they were talking about the cost differences between the two groups. It's about $14,000 a year, I think, to cover the folks that are younger than 65, and only $3,400 or so to cover the ones that are over 65. It's just because 80% of the cost is covered by Medicare. So let's go to slide 6. About 13% of the current TRS retirees participate in Care 1, which is the no-cost option. There are various reasons for this, and this is both pre-65 and over age 65. Some of those folks just enroll in Care 1 because they don't want to let the option go by. If they first retire, if they don't take a certain option with TRS, they may not be able to get back in. Some of them may have spousal. I'm not sure why they're all in Care 1, but some of those folks just can't afford it. So there are some of the folks that retire with very small annuities, and they go into Care 1. Care 1 has been funded by payroll contributions from the beginning. As payors, active teachers have always been payors. So even as TRS-Care got created, people paid for care before they got enrolled into it. So as they started to retire, they also made contributions through premiums if they took TRS-Care 2 or 3, but if they just took one, they still paid as active teachers. Retirees participating in Care 1 contributed plan, I just talked about that, and 87%, or about 180,000 of the participants use option 2 or 3, so they're paying premiums and out-of-pocket costs. Cost allocation. We believe that the total out-of-pocket cost that does not include premiums paid is about $1 billion out of pocket, because TRS covers both covered and non-covered services. And so in non-covered service, if you're a patient and the doctor says, hey, we know you're ill and insurance won't cover this test, but we think the test is going to help us figure out what's going on, and you're the retired teacher, you're going to pay for the test out of pocket. And so that's part of the out-of-pocket services that are covered. I know I've got more information than I have time. So the idea is that retirees are paying both costs and premiums. The funding for TRS-Care, as we all know, is probably the biggest flaw of the entire system. It's based on payroll. Payroll grows slowly. Health insurance costs grow quickly. So when you're using that as the basis, then we have a difficult time keeping up with costs. I do want to point out, you can look at the historical structures there. There are times where in session we have shortfalls, and I do want to, I don't want to lose all my time, but I do want to say thank you for the last session where $768 million was done as a supplemental appropriation to TRS-Care. So we are appreciative of the state's commitment to the program. There are some groups out there that deal with cost savings versus cost shifting. There's been a lot of discussion about that today. There's a group that I heard listened and presented in Washington, D.C. one time called EduMedics. This is a group that I think they work with the agencies or the entity to identify people that may be in high-risk scenarios, and then they work with them on different kinds of programs to potentially go away from some of those things that are causing potential high risk, like obesity, for example. And so those are companies out there that work on those kinds of things. I think Humana and Aetna and other groups should be engaged in that. As far as the plan, Chair Huffman has worked on what I think is a very reasonable plan after 14 years of not having significant changes to a program. And so what we have, though, are still the costs. And so I think the only thing, I can answer all the questions that you want about it, but the plan as I understand it right now is that we are moving the pre-65 population potentially into either an HRA or a high deductible option. I think the HRA is probably less significant of an option now because of market forces may be changing, and the HD option may be the more preferred option. Even doing that, we still have shortfalls. Those were talked about this morning. And I think it is vitally important that if that is the direction that the legislature moves, it does not mean that the $1 billion unfunded liability to this health insurance program goes away. It just means that it's been pushed down to the retirees in this solution. And what is TRS-Care 1 right now is free, will become essentially a $430 a month premium. And as you identified as TRS presented this morning, it's a $4,000 deductible with an $8,000 out-of-pocket. I think it's $7,150 maximum out-of-pocket. And so a retiree, because retired teachers are very conservative to begin with, retired teachers probably should plan, if they're under the age of 65, if that plan were to be adopted, to probably have at least $10,000 a year budgeted for health insurance costs. And more than likely, about $13,000 budgeted just to cover the costs associated with the plan. So premiums, we get that. But if I go to the doctor and they prescribe medicine, the plan would say if I have to go to get the medicine, it may cost me $200 or $300. What was potentially a $65 copay today is now going to be $200 or $300. It's just how the plan is structured, and I'm not saying it's wrong. I'm just saying that's how it would be moved down. So I don't know that there's besides the potentially putting this group with younger lives. It's just sort of cost shifting. I think Brian, Director Guthrie said it.
Cost shifting to the active teachers if you move it all together? Well,
I'm not suggesting that. I think that what Director Guthrie was saying is that there's no low-hanging fruit left in TRS-Care.
Yeah, we get that.
Yeah. So if there were options with a younger population over time, what you could do is potentially manage their care in a different way. Because as a retiree-only plan, some of the things that have been talked about with ERS that were talked about this morning, we don't have the same opportunities to potentially bring them along into our program as a retiree-only program to potentially be dealing with their care in a different way.
Members, questions, Senator?
Yes, thank you, Senator Shortner. And I have a couple of questions, but just talking about the active care and the putting it with care, there's a lot of obstacles on that. For one, many of the active programs, the state doesn't have control of them. You know, they're independently run by like some of the big school districts like HISD. So the state would have to decide that they want to tell all the school districts, they're not state employees anyway, the teachers, that they need to come into our program so we can put the retired teachers in with them. I don't think that that's a realistic approach. But we understand we're going to have some buy-in from the retired teachers and I worked with you, and I know you're trying to educate the retired teachers to explain to them how dire the situation is. And I'm just looking a little bit at the end of your notes. You didn't really get to them, but I don't see anything offhand, just looking at it, where you are offering a solution that's better or different than what we have come together. I mean, I don't see you offering a solution different than what we have come up with. I do understand you keep saying shared pain, but I've looked at these numbers again from TRS and LBB, and in the last 2 sessions, we have supplemented the fund almost $1 billion, $768 million last session, and almost $150 million the session before, plus some. So I feel like definitely last session and somewhat the session before, there was tried to move y'all towards the discussions and some reforms, and especially last year, it just shut it down. But the state did their part of the pain. I think $1 billion is kind of a lot of pain, and that doesn't count. That's just supplemental funding. That doesn't count what the state contributes anyway, which is significant. So how do we solve this problem?
I think the best answer is we have to take a closer look at how is it going to be funded.
We have taken a very close look at this.
Well, more than
these platitudes don't solve this problem. You know, we are looking at. We know exactly how it's funded. It's funded by a formula through the school funding formula, and we know that the way it's funded doesn't reflect healthcare costs. You know, that's what the problem is. ERS we fund it as healthcare costs go up, and TRS we don't. There's a set fund, and then we have to supplement it. You and I have talked about this. I don't think it's realistic that we are going to ask the school districts to put in more, because that would, in my opinion, really equate to cutting funding for public schools. Because if they had to pick up costs for healthcare retired teachers, if we switch this $1.2 billion over to the school district, I think that's a cut in public school funding. In my opinion, maybe there's some people that disagree with me, but I don't think so. I think Brian from TRS made it really clear we're out of options.
we are certainly between a rock and a hard place. The question is, how do we distribute this cost? And if the legislation is adopted, it will be shifted to the retirees. And if that's the decision, then our members are going to learn. It'll be difficult. Some people will drop out. I really do predict that some people that are pre-65 will not be able to participate.
And they may go on their husband's insurance or different things like that, or do different things.
If they do, I'm curious about whether or not TRS would allow them to re-enroll at age 65.
I don't know. That's a question you'd have to ask. We'd have to ask TRS.
Thank you very much.
Don't know the answer to that.
So outside of that, I think that anyone who is in the pipeline to retire should be told today that if you are planning to retire and you are thinking about using TRS-Care as your insurance option, that world is dramatically different, potentially.
Okay.
So that is a very important part. And somebody who is 62, 63 years old, if they know that their insurance costs are going to be more than $10,000 a year, they may want to know that before they're deciding to retire.
Okay.
So, but I also think that if there is going to be health care for retired school employees, I'm trying not to make it a platitude. We cannot use 1% of payroll as the basis for funding for a health insurance program, that there's nothing that the retired teachers are doing that is causing those prices to explode. It is the marketplace. We cannot run this insurance program on 1% of payroll, because if this model is adopted and there's an $800 million shortfall the next session, the model has been adopted that the costs are just shifted. The out-of-pocket costs will just be pushed down to the pre-65 population.
Right.
So I just think that's the realistic view, and
Right.
you and I are agreeing on that point, I
Right.
believe.
And the state is reluctant, or I don't think the state will commit to a higher percentage at this point, especially not knowing what the cost will be in the future.
I don't disagree.
So,
If
and
I,
even with this plan, we still, as we've talked about, TRS is a little back and forth on what the shortfall will be because I don't think they specifically know, but it could be between 50 million to 250 to 300 million.
Well,
Hopefully it's in the $50 million range because, we could probably find 50 million, I would hope. But that's the problem. So,
I don't disagree, and it seems as though, the state and the retiree population are the two that are trying to figure out how to handle the $1 billion shortfall. I get it that districts can't pay. I get it that active teachers, they have extremely difficult circumstances with their own health insurance, and I'm extremely empathetic to that. But I know retired teachers that go to one of my 254 local chapters that will stay until the end of the meeting just to pack up the food to take home to eat. Mm-hmm. So they don't have a lot of money either. And it's just a very difficult circumstance.
I understand
and
that.
I absolutely want to work with you. And I absolutely worked with you last session. You're a great person to work with.
I want to say something. Let's remember that we're not affecting the over 65 people, the ones who are probably a little more vulnerable and they are not going to be affected that much by this change. Mike, is that correct?
Well, their premiums are going to go up 100%.
Not in every category. That's just not true.
Well, if I'm a
Because we have
Medicare
different
Advantage,
tiers, and that's just not
I'm
true.
only using apples to apples. If I'm a
Okay,
Medicare
well.
Advantage 3 retiree,
Okay.
I'm paying $75 a month for my premium. It's a great deal. TRS has $940 million in discounts applied to this health insurance program. Tremendous deal for all of us. So that premium, illustrative of what we saw in the program, would go to $146. And I may be a little bit off on 100%. So it goes up significantly. What the plan does that is great, that I think everybody should applaud, is that you have a group of retirees that were not paying the Medicare tax in 1986 and didn't switch jobs. Those folks are paying $230 a month right now. Their premiums would go to $146. So that's great. And I love how you and TRS were able to figure out how to make that happen, because I don't believe that was possible a year or two ago, because I was under the impression that somebody who didn't qualify for Medicare A could not participate in a Medicare Advantage plan. So if that can happen, that's great. But you're going to have a lot of folks, and this is a big problem. The number today was 60-40. 60% in Medicare Advantage and 40% that are not. I think Director Guthrie is correct. As people say it's effective, then they may join it. But that's not the problem. The problem is that doctors and hospital networks refuse to take the Medicare Advantage plan. And retirees call up and say, I've got TRS-Care. It's a group health insurance plan. And Kelsey Siebel may say, well, we're not going to take it because they have a facility fee.
And I think you heard TRS say that they plan to negotiate that. And if there are members in certain areas that can't get into certain plans, that they're going to work with them. That's part of the plan, is to make sure that everyone has access to care.
Madam Chair, they have done a great job negotiating. There are extreme holdouts in the doctor and hospital network groups.
Well,
and unfortunately, something that should also be addressed is that when TRS is negotiating with those doctor groups or those hospital groups, the hospital groups frequently buy ad space in newspapers, gigantic full-page ads. If you're a retired teacher with TRS-Care, we won't take your insurance. Call TRS today and tell them that you want the Medicare supplement plan. And guess what? All the retirees start calling us. They'll call me. They'll call you. And when they finally finish the negotiation, do they buy another advertisement in the paper saying, oh, we got a contract resolution, we're going to take the plan? No. Now all the retirees are too afraid to take the Medicare Advantage plan. So there are other barriers. It is not just let's all talk to each other. There are serious barriers. I think that if a hospital group or a doctor group is taking federal or state dollars, they should be highly encouraged to take one of our TRS-Care group insurance plans.
Well, maybe Dr. Shortner could put that on his list of the suggestions.
I'll
I've
put it
seen
on my list.
taking notes down there. Well, there are little things that we could do like that to make a difference, and that's the kind of things that we're here for, and we want to hear those ideas. Okay.
My time. Thank you very much.
Thank you. Thank you. I'm sorry I called you Dr. Shortner, Senator Shortner.
Thank you. Thank you. Any other questions for Mr. Lee? Well, got our work cut out ahead of us, don't we?
Thank you, Vice Chair Hinojosa, members of the committee. Very happy to be here. Thank you for sticking around and listening to my testimony. I'm going to try to take a little bit different angle with TRS. It was interesting testimony, listening to the agency do a presentation. I thought they did a wonderful job. As a matter of fact, I think Texas has done a great job creating a very secure retirement system for 1.3 million Texans. We have one of the lowest cost teacher retirement systems in the country and one of the best funded teacher retirement systems in the country. The state of Texas benefits greatly by not sending 12.4% of payroll to the federal government to manage through the Social Security program. And more than 7 decades ago, we decided to create a defined benefit retirement system. And I think that you all have done a great job with the agency managing that retirement system. Is it perfect? No system is ever perfect. Can it be improved? Absolutely. Do we always have to make improvements? Yes, and that's what we do, and we've done it for a long time. I do want to congratulate TRS also on making or earning 7.4% in a very difficult environment. I thought their investment return was great. It wasn't the 8%, and I know there's going to be some discussion in the future about should that be less. I think you always have to consider that whenever you take pressure away from one area, it adds pressure someplace else. And so if you change the rate of return assumption, even by 0.5%, it adds $10 billion of unfunded liability for the future. And so to offset that, you must consider increasing contributions somewhere, whether it's the employee or the employer. I really do want to focus on TRS-Care because that is probably the most important thing facing retirees today. 250,000 folks participate in TRS-Care. Some things that need to be, I think, pointed out. Yes, the cost of a pre-65 retiree is $13,700. However, Medicare is taking over the other portion of that cost. The cost is still the same. As a matter of fact, it's probably a higher cost for a 65 or over individual, but Medicare is actually paying $1.56 billion of total claims for the program. The medical and prescription drug discounts that is actually won by TRS-Care through tight negotiations with providers provides $940 million annually in cost savings to the state and the retirees who participate in the plan. Almost $200 million in federal Part D subsidies. Retiree premiums are $375 million, and out-of-pocket costs in both covered and non-covered services probably exceeds $1 billion annually. So we know, and I think probably the most important thing that I want to say here today is money is necessary to save this program. And retirees are ready to come to the table and talk about benefit adjustments and premium adjustments that may be necessary to save TRS-Care.
Thank you for your testimony.
Thank you very much. Good afternoon, everybody. Thank you for the time this afternoon. And my name is Tim Lee. I'm the Executive Director of the Texas Retired Teachers Association. And I've written most of my testimony just so I can stay on track. But most of my opening statement was what Chairman Estes just said, so I get to skip that entire section. So it is a problem, and I think that if we work together, we can solve it. So I know that we are probably a little bit of TRS-Care fatigue. We really do appreciate last session the work that was done on behalf of this issue to put in $768 million into this health insurance plan. And as unfortunate as it is, we're coming back to deal with it systemically now. So with that, I'll start with the reality is that we are funding our TRS-Care with a pay-as-you-go strategy. Unfortunately, we did not adopt a funding philosophy in the middle 1980s when this program was implemented to fund it like we do our pension plan, which was started in around 1935 on a pre-funded basis. Now, the pay-as-you-go costs are almost exactly as high as the cost to pre-fund this program. This fact should be enough to concern us all, and it should inspire us to immediate action. And before I get into a lot of the numbers, let me say that the TRS-Care story is a bit of good news, bad news. The good news is that for nearly 3 decades, this plan has been very successful in providing quality health care benefits at a reasonable cost to hundreds of thousands of our retired public school employees. This health care includes medical benefits, prescription drug benefits, advanced medical care, and more. There is not one of us in this room that does not know a retired educator or school employee who has benefited from the TRS-Care plan. TRS-Care is also a vital part of the Texas medical community, providing for jobs and research and needed infrastructure in our local communities. as part of our educators' expected retirement benefits, we have to recognize that TRS-Care is an integral part of their retirement security. As you know, TRS retirement benefits are very modest, and most of our retired educators did not pay into the Social Security system. In fact, one study has shown that the Texas teacher retirement system benefits are on average about 30% less than other states that are also not coordinated with Social Security. Today, the TRS-Care plan is a shared payment system for funding. The employer, both the state and the school district, our active employees, our retirees, and even the federal government are all providing revenue for this plan. Now we start with the bad news. And unfortunately, the revenue that we're receiving is simply not enough to keep the plan solvent. I know we'll get an updated number from TRS in just a few minutes, but the last information I had is we have about a $1.5 to $1.7 billion projected shortfall in the coming biennium. And that shortfall is expected to grow by the billions of dollars for the foreseeable future. We cannot allow these issues to go unaddressed. The fact is there is no cost savings measure, no magical medical metric, no one-size-fits-all approach. There's no evil person or evil entity that we can blame. The fact is healthcare costs money. We know that we are not pre-funding this cost. We know that our TRS retirees are not any more significant a health risk than, say, a state employee retiree. We know that issues like compound drugs and specialty drugs have an impact, but we also know that TRS and its medical administrator are quick to manage and mitigate many of those costs, though we should be concerned especially about specialty drugs and the like. We know that we are basing revenue for this healthcare plan on the aggregate payroll of our school employees. And we know that a TRS-Care plan participant is receiving about $125 per month in subsidy from the state towards the cost of their care. Only as a comparison, a state employee retiree is receiving about $600 a month towards the cost of their health care. This does not take into account the funding that the state provides to subsidize a retired state employee's spousal premiums by about 50%. The sad and unfortunate reality is that healthcare does cost money, and we are not collecting enough revenue to pay the bills. So how much revenue are we getting? Well, in general, we're getting about $1.7 billion from the federal government. That includes the Medicare A and Medicare D subsidies. That's an annual number. Retirees, the folks that are behind me today, and they're very concerned about this issue, they pay about $370 million a year in premiums. And then their out-of-pocket costs and any other non-covered expenses is about $1 billion a year. So that's what the retirees are paying out. The state contribution of 1% to this plan is about $280 million a year. It's a very significant amount of money. And that fluctuates because it is based on aggregate teacher payroll. And as you know, the one-time appropriation approved in the regular session of the $768 million, it did not get included in the baseline budget, so we can only assume that that's a one-time appropriation. A major revenue source that often goes unnoticed is the provider discount, which totals about $940 million a year. And I think that's an important amount because it's a great credit to the value quotient that TRS is adding to this. That is through Aetna, which is the provider, and our PBM. It's how TRS can negotiate with the partners that they have to provide a reduced cost for benefits, and it's a significant number. We receive about $230 million in rebates and discounts annually, and our school districts and our school employees both contribute annually about $200 million each. So after you go through all the numbers and you look at the value of this program, we still have a bottom line that must be dealt with. And the bottom line is this. We need more revenue to keep this plan sustainable, healthcare beneficial and affordable to more than 200,000 retirees and about 50,000 dependents that are in the plan. Can we find additional cost savings? Yes. Are TRTA members and retirees in general interested in working with the state of Texas and TRS on plan changes or other ways to help save money? Of course. Are we ready to look at this issue in a different way or come to the table and deal and work with all of our friends and partners in the legislature, TRS, our retirees? Absolutely. Let's face it, retired school employees have done more with less their entire careers and in their retirement life. But I want to be very clear, there is no combination of plan design changes that comes close to fixing this problem. We may save a couple of $100 million, and that's certainly a lot of money that we can potentially save. But we still need cash value of at least $1.2 billion or more. And that is, that's a discussion about premiums and so on that we can have. One of our favorite sayings at TRTA is, what is the bottom line? Well, here it is. At the end of the next regular session, if no major changes are made to the funding of this program, TRS has one payer of last resort. It is the retiree. A funding shortfall of $1.5 billion with no major funding or plan changes will be paid by retirees through premiums. It is the only source of revenue that TRS can control without legislative authorization. And if that's the case, we expect that premiums will triple sometime around September 1st, 2017. If we recognize that the reality of 53.6% of our TRS retirees make $2,000 a month or less in their retirement, there is no fiscal path forward for TRS-Care and the burden of this health care cost to fall completely on the backs of our retired school employees. TRTA recognizes the seriousness of this situation, and we want to help. We want to be a part of the solution. We can and we will find the right answer, but it will take hard work and effort on all of our parts. And we are ready to accept that challenge with you. And we've solved big problems before, and we want to do it again. And I'm happy to answer any questions that you might have.
Okay, does anyone have any questions so far? No? Okay, thank you for your testimony.